Our next session is on AI in the medical world, and we have Jayashree Kalpathy-Cramer from UCHealth. Thank you.
Thank you for the invitation to be here today. Now for something quite different. We're going to talk a little bit for the next few minutes about AI. So I do a lot of research in AI. So I use AI to create my slides, to do pretty much everything. So just heads up. It's really absolutely revolutionizing like everything around us, right? You can sort your photos, you can unlock your phone, you can self-drive, you can do pretty much everything. So if you don't mind, it didn't quite show up. So how many of you are like very familiar with chatbots and LLMs? Not a lot. So what is AI? The idea with AI is that you're developing intelligence. You're building a computer that can sort of think and do things like humans do, perhaps. And how do you do that? You take all of the data that is out there, whether it is data from clinical trials, data from patients, data from Wikipedia, data from the news, from all of that, and you train your models to sort of learn patterns in these data. This field has been actually around for more than 60, 70 years. Started in the mid-50s, the 1950s. It's had these, what they call winters. It gets very popular. It gets out of favor. It comes back into favor. This whole area of AI, there's subsets within that. There's areas that are called machine learning. That is a popular term. It's, again, the idea with machine learning is you're not creating rules. So very often we have these flowcharts. We have these human-defined rules. In the case of AI, what we actually do is have the machine learn those rules automatically. So instead of saying, if this, then else, the machine says, OK, given all of these data, then this is my rule. We now started to have something called neural networks, deep learning. And as the field has evolved over the last decade or two, we are in this era of large language models, generative AI. So we've gone for something that used to be called supervised learning, where we had to say, OK, here's a picture of a cat. Here's a picture of a dog. You train a computer to say, is it a cat or a dog? Or you take a picture of somebody's face. You know whose name it is. You've gone from that to doing something where you can actually generate new images. You can go to ChatGPT and say, or Gemini or whatever, and say, OK, create me a picture of whatever. And so that is the whole area of generative AI. Again, this is sort of a very brief history. Started in the 50s. The term was coined about then. It was sort of marching along with these different winters. But ever since 2018, we really, and specifically since ChatGPT became sort of a household name, it's sort of become very common. Who has not heard of ChatGPT here? OK, excellent. So it's just remarkable how every day there's a new model that's been reported. OpenAI comes with something, Google comes with something else, Amazon comes with something. So the field is sort of exploding rather quickly. So how often do you use AI? I use it almost hourly. What do I use it for today? I use it for pretty much everything. I use it for work. I use it for generating research ideas. I use it a lot for coding. I do a lot of developing algorithms. I use it for hobbies. I use it for learning new stuff, generating ideas for research. I know that the top left is one that one should not do, but I think many people do, which is learn about health-related questions. One should never put one's PHI into public-facing chatbots. But who here has done that? Exactly. So many of us completely ignore wisdom and use it because can be quite helpful. So you've seen so many people report this. I've been struggling with this for 10 years. I've gone to doctor after doctor after doctor. I just loaded up my health record, and ChatGPT told me right away that it is whatever it was. There are many, many reasons to not do that. There's no guarantees of privacy. If you have your health system set up the systems, it's fine. But the public-facing open ChatGPT, you never know what is going to happen with that information. So putting patient data in something like that is absolutely something one should never, never consider doing. So more recently, there's been a lot of talk about how patients are using ChatGPT. How many here have had patients tell them they use it? Quite a few, right? So patients are coming in to providers saying, I asked ChatGPT, I mean, it used to be Dr. Google before that, now it's ChatGPT, but I asked ChatGPT for a variety of things, and there's definitely good and bad. As you can see, there's becoming on the bottom left, there's a fairly recent article that said it's becoming a stand-in doctor, so people are using it. If you can't get to see your clinician, people ask ChatGPT, what should I do? How urgent is it? What does this mean? Or sometimes people are using it to explain reports. I got this, you can see a medical record. I have no idea what these terms mean. Can you translate these terms into sort of more lay language? What are the implications? What's my prognosis? So people are doing that. Whether or not they should is a different question, but again, people are doing that. And this was a year ago, which is about a quarter of young adults use it at least once a month for health advice. More recently, it's a lot more than that. So again, people, patients, children, everyone's using these for health information, and that's something that, as a community, we should be a little wary about. So in terms of what's been more frustrating, this is a survey I did somewhere else. It sometimes gives you the wrong answer. It makes stuff up. It can be quite wrong. It can be confidently wrong. It'll assure you something is the right answer and be like really, really wrong. So one has to be, again, very careful about how to do that. So in the more sort of clinical space, what sorts of things are we seeing now for the use of AI? So there's a ton. If you look at the published literature, look in PubMed, look anywhere, and look at the search term AI, it's almost a vertical rise. The number of publications every month that use AI to do something in medicine are just absolutely exploding. It's just entirely across the whole space. So people, like early cancer detection is an area that's extremely popular. So whether it's image-based or screening for various things. So lots and lots of uses for again, these AI models in that space. We heard a little about the sort of how do you think about personalized risk. There's a variety of AI tools that are coming. Not very many of them have been sort of validated widely, but they potentially can help you personalize risk. So the sort of holy grail might be you take somebody's genetic information, you take their demographics, you take their imaging, you take their pathology, you put it all in, and it really gives you a very personalized set of treatment options. That is where the field is trying to evolve to. I'm not sure when and if we'll get there, but that's definitely an area that the field is working on. Diagnosis and treatment recommendations is, again, huge area. The idea with these large language models is they can take a lot of the information that's been published. You can take published literature, and you can ask it to sort of synthesize that information. Has anybody here used Gemini or Notebook LM? OK, I'll come to that in a second. If you haven't, I would really highly recommend. By the way, I have no affiliations with Google or OpenAI or any of these things. These are just as a personal opinion. But there's a tool that Google has put out called Notebook LM. You can upload any PDF into it, and you can chat with the PDF. So you can ask the PDF, can you summarize this study and tell me what it found? You can take 5 studies and say, OK, take all of these 5 studies, and can you synthesize all that information into something that I can consume? Unlike ChatGPT, which can hallucinate or make stuff up sometimes, this one will actually take you to exactly the spot where it said it. So you can click on it and say, OK, in table 2C of this PDF, it said here are the numbers, here's the hazard, whatever the information you are. So it is a lot more grounded in the documents that you upload. And it's really sort of restricted to the documents you upload. The other thing it can do for you is create a podcast. So again, if you haven't, go to Notebook LM and upload your documents and ask it to create a podcast. You can listen to it on your drive to work or anywhere else. I do that very often. I upload 30 documents that I want to do, ask it to create a podcast. You can say how many people are on your podcast. And the new feature is kind of crazy. You can actually interrupt the podcast and ask it a question. So you can say, wait a minute, I have this question. Can you, based on the information in these documents, can you help me understand that? So we talked a little bit about that. This is a really wonderful book if you haven't read it. A couple years ago now, it seems ancient history. This is, again, 2024. But this was an older version. This is early versions of ChatGPT. And it can actually have a fairly nuanced set of responses to questions. If you ask it to, again, provide sources and ground it, you can trust it a little more. If not, many of these chatbots will sometimes still hallucinate. This is an area that is getting pretty popular. How many people here use ambient scribes? Anybody? OK. So in many institutions, things like Abridge or DAX or other things are available where basically as you're talking to there's a conversation happening between the patient and the provider. There's a listening bot, and it transcribes and summarizes and puts it all into notes. So Abridge is one company that is doing that. There are many other companies, Microsoft and others. And the idea is to try to reduce the burden in terms of documentation, to capture sort of the conversation so you don't have to later enter notes. And then you can always validate any and all part of it. Some of these things are complicated because very often you have a patient, you may have their caregivers, you may have children, you have multiple voices, and the chatbot is really, the listening agent is trying to figure out who said what and making sure that you can figure out all of that, and how do you summarize all of that. But this is something that is there today. It's being used in many institutions, and it's actually proceeding at a pretty nice clip. Another one is for patient communication. This can be really helpful. If patients want 24/7 questions, they can ask the chatbot. You can help with reminders for triage, lots of different things with that. Again, very common area. This is something that is, again, helpful, helping understand information that is in a patient's medical record. So for instance, this is, again, from that book. You say, I received this explanation of benefits. I have no idea what it means. Can you please explain it to me in sort of lay language? And so it can do things like that quite well as well. Predicting outcomes. This is, from the research perspective, this is a very hot area. Using lots and lots of data, can you create prognostic models? Can you update them as you get new information, as the patient's trajectory changes? What can you do there as well? Clinical trials is a big area. Can you use AI to help recruit and identify patients who are best suited for a trial? So there's been a few different systems that will say, OK, here are all the clinical trials that are recruiting right now with their inclusion and exclusion criteria. Here's my new patient. Which of these trials is this patient a good fit for? That task can be very onerous. And again, we know how much of a challenge it is to get patient recruitment for trials. And some of these AI tools are really sort of helping, saying, OK, this patient right here is probably a good fit for this trial. And then obviously the human would have to validate and follow up on that. Real-time symptom monitoring, so allowing people, the symptoms to be tracked continuously, notifications, communications. Lots of tools are coming in that area as well. Explaining virtual nurturing, and then lots of things around workflow optimization. So how do you help with documentation? How do you help with task automation in data-driven insights? Inbox management. So I think at many institutions, they're starting to explore the use of responses to inbox in messages. Can the AI draft a response? And then do you then accept it? Do you reject it? Do you say, OK, it's good enough? And one has to be very careful, because it can sometimes really take the most extreme situation and respond with, I think Dr. C.T. Lin in our institution mentioned this once. Somebody was talking, I don't remember exactly, but they said something about sort of fluid from the nose, and it was like, oh my God, it could be a CSF leak. So it sort of takes the most extreme view and says, oh, this could be like a very extreme thing. So one has to be very careful about letting this loose. And again, the questions about the ethics of it. Should you let the patient know that you're using AI in any part of it? How much are you allowed to use without saying you used it? So lots of questions to be answered in that thing as well. We talked a little bit about that, symptom management. This is another great area, which is patient education and language access. So again, you can use it for education, for translating, going from one language to another, going from technical language to lay language. All of these things, the algorithms, the tools like LLMs can do really quite well. Always good to have a human validate everything it says, but if it is a patient or a language that you're not familiar with, it's a pretty good first start at least. Safety checks. An area that I do a lot of work in is imaging. And so I think we are getting to the point, and there was actually a very famous computer scientist who said quite a few years ago that we should actually stop training radiologists because computers will AI will take over the radiology. We don't need any more radiologists. That didn't quite come to pass, but we are seeing a lot of use of AI in radiology very specifically. So, and pathology actually. So right now, there's over 1,000 clinical AI applications in the field of radiology that have been cleared by the FDA. 1,000 overall, of which more than 850 of them, I think, are in radiology. And even the ones not in radiology, like in cardiology and neurology, often have to do with imaging. So these are some of the things that we do in our lab. So tumor, measuring the size of things. How big is a tumor? Is it growing? Is it getting better? Essentially, radiation treatment planning. Can you segment all of the lesions and the organs at risk? And in fact, can you segment every structure in that CT? How do you use that? This is from a research perspective, this is a really interesting area. Can you automatically, you have a CT of a patient, you take these algorithms that measure body composition, body fat, bone density. So you can look at things like sarcopenia, cachexia, and do things that you could not do more automatically because it would be very painful to do that. So how is a patient's frailty sort of changing over their treatment of the treatment course, and what do things like body composition have to do in terms of predicting outcomes and things like that? Here's a project I'm working on, I've been working on for a couple of years in terms of cervical cancer screening in low resource settings. A huge problem currently, the state of the art is inspection with applying acetic acid and then inspecting the cervix. There's lots of different reasons why this is not perfect. So we are working on this screen triage model where we have this happening in sort of clinics in 9 countries across the globe, in Cambodia, Tanzania, and so on. And then we've screened a lot of women where we have a HPV typing. So we first do self-sampled HPV testing, HPV typing, and then use AI with the imaging to then give a risk assessment of the overall risk that combines the HPV and the image itself. So just a sort of smattering of things that people are using in the oncology space with AI, but what can go wrong? Lots and lots and lots of things can go wrong. We really hope they don't. Hallucinations, again, we've seen that it can make stuff up. There's definitely a concern about sort of worsening divide across many different ways. Automation bias. Automation bias is a really interesting one, right? So most of us forgotten how to do long multiplication or division because we all use calculators. Kids these days, without a GPS, may not know how to get from point A to point B. We completely sort of turn off our brain when there's a machine in our hand doing the thinking for us. How do we make sure that when AI is doing that for us, that we continue to engage our brain, continue to make, if it's correct, like 95% of the time, you really start to trust it to the point that you're like, okay, it's going to be fine. And you don't really engage with every decision that it's making. So thinking carefully about the potential for automation bias is huge. Related to that is this concept of descaling, right? When hospitals go to EHRs and one day there's no Wi-Fi power and you're going to go back to a paper chart, people don't know how to do that, things come to a complete halt. If you become so dependent on technology that you cannot do the things that you used to do without it, it is definitely a form of descaling. On the other hand, there's obviously lots and lots of advantages. Inadequate validation, there's lots of security vulnerabilities. We want to make sure that all of our ethical and regulatory concerns are addressed, and making sure we have informed consent for a lot of that. So this is the thing that I was talking about, called Notebook LM. This is what it looks like. On the left, you can upload your PDFs. On the right, in the middle, it'll create you a summary of every one of those documents with citations, so you can click on it. And on the right, it'll create you either a video or a podcast or a summary or set of slides. I don't know if it'll play, probably not. But anyway, so these tools are amazing, and one should really explore how and when they're appropriate to use and the things that they can do for you. So it's definitely an ethical tightrope, I think. There's a lot of power for AI, but we need to make sure that we're thinking carefully about how we build trust, how do we make systems that are actually usable, transparency, fairness, lots of different questions. And we need to come together as a community between the data scientists, the clinicians, the nurses, the caregivers, the patients. Every stakeholder has to come together to figure out how it makes sense to use AI. So thank you.
Thank you so much. I know this is a hot topic, but we are also behind time, so I'm going to skip on questions.